Yeah, I am ready.
Are you ready?
Yeah.
Okay. Good afternoon to everybody. We have with us Professor D. Narayana. As most of you may know him, he was at Center for Development Studies, Trivandrum. And after a stage, he left Center for Development Studies and joined Gulati Institute of Finance and Taxation as the first director of the institute. Then he was there for a fairly long period. After that, he retired from Gulati Institute. Now he is engaged in research in various ways. He has published a lot on various aspects of Kerala economy. He is particularly a specialist in health economics and public finance. I accord a very warm welcome to Professor Narayana. And Professor Narayana, we have students who are the MSc program, MSc Econometrics and Financial Technology. So they learn economics, finance, econometrics, and financial technology. So I request you to deliver the address. Please.
Thank you very much. Am I audible? Is everything okay? Professor Sukumaran Nair and students. Now, first of all, thank you very much for inviting me to deliver a lecture. Now, this doesn't strictly fit in with econometrics or finance in the normal sense in which you use it, but I wish to convey two or three powerful messages through this presentation. One is, you always wonder how policies are made, and I'm going to convey a certain message. How policies, you may often see there is a national policy document. A lot of things are said, but the realization of a lot of those things will depend upon what is allocated in the budget. Otherwise, they simply remain words and more words. I'll rather illustrate through this presentation that, and especially in a federal polity like ours, how complex this whole policy making is. You may do a lot of research. No, I'll again illustrate that and produce a good document about a sector and may even make recommendations. But how it can all be just nullified in just one go. This is a sort of second message that I will try to convey. It's a slightly longer presentation, as I was telling Professor Sukumaran. I have about 45 slides, but some of it I'll quickly go over. But some we might have to spend more time. So let us see. It all, at the end of it, it all depends on your interest. If you get interested, well and good. If you don't, then I will consider it a failure, my failure. Anyway, so with these words, thanking you again, Professor Sukumaran Nair, let me begin. Now, this is slightly old, the budget discussion. Budgets are normally discussed soon after they are presented, either in the assembly or in the parliament. Now, this was presented in 1st February, and now it's almost end of April. So 3 months, it's a long period when we discuss about budget. But, as I said, there are 2-3 very powerful messages that can come through this. That's why I think it is still very relevant. And also, it has a lot to do with our COVID. The friend has still not gone, so I think it's very relevant. So that's, by way of the motivation. Now, let me get down to the sort of a topic. But before that, I'll just, through this slide, what I want to convey is that yeah, is somebody talking? Okay. No, so basically these are the references that have gone into the making of, this talk. One is the Finance Commission document. That site is, I mentioned that site here. The other is, of course, the budget site and the documents, all statements of budget estimates and, that sort of, and page numbers. So these are the specific references that I have used. So if any of you want to verify or redo, go to these sort of websites and look at the documents, you will be able to do that, because that is what research stands for. If somebody wants to question, somebody wants to verify, somebody wants to see whether I have used the numbers, it's all there. These are the references. Okay. Now, budget. When we talk about the budget, what the governments often do is they have a certain responsibility. So they are trying to fulfill those responsibilities through the budgetary allocations and expenditure. Now, if you are talking about the union health budget, now we have to see, first of all, what is the responsibility of the union government as far as health is concerned. So if one has to find that, one has to look at the constitution, especially, in India, the constitution, India is a quasi-federal, polity. So we have to see what are the responsibilities of the central government or the union government, and what are the responsibilities of the state governments. And, so constitution, of course, is a big document. Now, for us, what is relevant is the 7th schedule of the constitution. That is where you have the distribution of the powers of the union and the state. So you all must have heard of this union list, state list, concurrent list, and things of that sort. Now, if you look at the, the union list, at one time, to begin with, it had 97 subjects, and now it is 100. The state list had 66 subjects to start with. Now it has only 61, because these are all evolving sort of a thing. Any polity is evolving. As it evolves, there are these changes which come about. So the concurrent list, at one, to begin with, it contained 47 subjects, but now has 52 subjects. And where does health come? Now, you will be surprised to find that the union list does not contain health. So, as far as the budget is concerned, the union has no responsibility if you go by the constitution, because it is not a subject mentioned in the union list. Then where does it come? In the state list, I have listed out the subjects in the order in which they appear. The first in the state list is public order, police, then comes land and water, then agriculture, etc., etc. And the 6th item is public health and sanitation, semicolon, hospitals and dispensaries. I attach a lot of significance to this framing of health in the state list. Now, here, public health doesn't mean that, all these government health institutions. Public health has a specific meaning. That is what comes first, public health and sanitation. Hospitals and dispensaries come second. And there is a semicolon in between. So obviously it has a lot of meaning, but I don't want to get into all that here. But at some of you, if you are interested, you can spend some time on it. Now, as I said, health does not appear in the union list. So it is not a responsibility of the union government. But then how does health enter the union budget? Now, the reason why health enters the union budget is it has done something over the last 50 years. Because in 1954, the central government started what's called the Central Government Health Scheme. It was a scheme for the serving and retired central government employees, basically to take care of their healthcare needs. So it provides comprehensive outpatient services, inpatient care in empaneled hospitals, specialist consultation, and there are all these sort of facilities which it started setting up, and that is called CGHS. Now, it has grown over the years because initially it was confined to Delhi, some of these hospitals and centers, but now there are a large number of them spread over, all over India. It has 4 hospitals, 370 wellness centers, 19 polyclinics, diagnostic centers, laboratories. It goes on and goes on. And that is one of the items since it has started in 1954. Now, since the central government has to spend money, it has to come into the budget. That's one item through which health appears in the union budget. The other, by now, you all must have heard of this AIMS, the All India Institute of Medical Sciences. Now, this was established in 1956 with a very lofty sort of a goal of produce the future leaders of Indian medicine and public health, the teachers and research workers. I think I have quoted it because some of you who are interested should definitely take this up and see how much AIMS has contributed in achieving this. So the original idea was to establish a center modeled after the Johns Hopkins University in the United States, probably because Johns Hopkins Medical Center was explicitly expected to combine patient care with the teaching and research. So AIMS was modeled after that, and it was an institute of national importance. So when the bill establishing the institute was introduced in the parliament, the then health minister, in fact, again made a very, very important statement. I quote, "Medical education must above all take into account the special needs of the country from the point of view of affording health protection to the people." Now, these are all very, very important principles enunciated at various points of time. That's how AIMS comes up. So this becomes a central responsibility. Then, over a period of time, even before that, there are these national programs, health programs, which were started at various points of time. Some started even before that 1954. Some have come and they have undergone a lot of changes. For example, the tuberculosis program. Now it's called the Revised National Program, launched in 1997. Before that, it had some other name. And then you have the blindness program, this control program, that control, a large number of these programs. You go to the DGHS, you will get this list of the things and what are the aims and all that. I don't think I should spend too much time on that. But then in 2005, something called National Rural Health Mission was launched, again by the union government, with the objective of providing accessible, affordable, and quality healthcare to the rural population. Take note of that word, the rural population. And make government health delivery system fully functional, meaning that though government has set up all these systems, they are not fully functional. So make them functional, decentralize the system and achieve high standards. So also develop human resources at the lowest level to fill these, centers or, PHCs and a whole lot of these things. So that's why the Rural Health Mission was launched in 2005. Initially, it focused on 18 states. I put those, names over there because these states were found to be suffering from the absence of a number of these very, very basic facilities. So that's why initially it focused on 18 states, but over a period of time, it was extended to other states. And it also aimed at mainstreaming Ayush. Ayush is a very, very important component. Over the years, it has become more important. So, and in 2013, National Urban Health Mission was also launched as a sub-mission of the National Health Mission. Now, it aimed at meeting the health needs of the urban population with a special focus on the poor and vulnerable. Now, the aim was to cover all cities with population above 50,000. And of course, the funding, initially it was 75 by the central government and 25 by the state. But over the years, these days, proportions have changed. Center's share has steadily come down. Then in 2008, a major program was launched, which was called Rashtriya Swasthya Bima Yojana. Now it is actually, in 2017, it was renamed and the sum assured became larger. It was 5 lakhs when it started, it was 3 lakhs. And its main aim is one of the SDG goals, that is universal health coverage. Now, but though it's called universal health coverage, but the central government covers only the BPL and inpatient care and part of catastrophic health expenditure. So the burden is entirely on the state to achieve universal health coverage. Because in a state like Kerala, if you take the BPL, it's not even 10% of the population. So if you are talking about universal health coverage, this one, covers a very, very small proportion of the population. Okay. So, but it's a national sort of a program. So this is how health enters the union budget. Over the years, there were some of these things which were started like CGHS to take care of the employees, then aims for teaching, research, then national programs for controlling a number of diseases, then Rashtriya Swasthya Bima Yojana or the insurance program to basically, address the issue of catastrophic healthcare expenditure. So, how has the budget presented on February 1st handled allocations to these programs? But when I ask that question, health allocation normally falls into 3 categories. One, the Finance Commission grants, then the Ministry of Ayush, then the Ministry of Health and Family Welfare. These are the 3 categories. Now, 15th Finance Commission, because its award, is what is current. It is from 21-22 to 25-26, the 5 years. So, what it has, if it is awarded, grants for health, then that will get reflected in the budget. Then, Ayush, it's a priority of National Health Mission and Ministry of Health and Family Welfare. Now, I'll have more to say on Finance Commission, so I will not cover too much here. I just wanted to mention for completion. Okay, so 3 categories. One should be looking for these 3 in the union health budget as far as health is concerned. Now, that's what we are doing. Just look at it. This is how the allocations have been made in the union budget. Finance Commission grants. Then are, of course, other grants also. You know what these other grants are? That 35,000 in 21-22 budget. This is for vaccination. You must have read about this. And though the allocation in the budget was 35,000, they actually spent, ended up spending 39,000. But now look at the allocation for next year, that is this year, 20-23. It's just 5,000. So center doesn't take any responsibility for, if you have to vaccinate people again or do something, they have not made an allocation for that. Then you have Ministry of Ayush. Just look at that. 2021 actual was 23,000 roughly. A 30% increase in the budget allocation 21-22, but they didn't spend all that. But still, it was about 16% higher compared to 2021. And next year's allocation is about 15% higher compared to this year what they have spent. So Ministry of Ayush is very well taken care of. If total expenditure is growing at 10%, in fact, there is a disproportionately high amount that has been allocated to the Ministry of Ayush. Then you have the Ministry of Health and Family Welfare, which has two departments, the Department of Health and Family Welfare and Department of Health Research. How much, that is the main sort of a item in this entire allocation. Now, Ministry of Health and Family Welfare, 2021, it was something like 77,000. Now you look at the numbers, what happened? This was 21-22, because 2021 we had the COVID starting, and then 21-22, you look at the allocation, it was 8% lower than what was spent in 2021. But of course, they could not manage with that. There was more demand. So in the end, it ended up, instead of an 8% decrease, an 8% increase. So, but still only 8% compared to 2021. Now, what have they done as far as the next year is concerned? Practically no change. 82,920. Now the allocation for next year is only 83,000. So the health doesn't get more money, even though it is COVID and all this suffering. As far as the central government is concerned, Ministry of Health and Family Welfare, the budgetary allocation just doesn't go up. And then Ministry of Health and Family Welfare, Department of Health Research. Department of Health Research has various things, but the main element is ICMR, Indian Council of Medical Research. 2021, about 50% of the total allocation for this department went to ICMR. But you see what has happened in the next year? It's almost entirely, almost 70% or 80% is for ICMR. Firstly, the total has not gone up. Second, more of it has gone to ICMR. So that is, in a nutshell, your budgetary allocation at a very broad head. So the message is no increase. Now, if you look at the Ministry of, the Department of Health and Family Welfare, what are the items? There are these 4 or 5 items, major items. One is what's called Centers Establishment Expenditure. That is the direction and administration. Any ministry has that as a component. Here, it also has all these hospitals in Delhi. Hospitals like Safdarjung, Ram Manohar Lohia, and a whole lot of those hospitals. They are funded by the central government. So that is Centers Establishment Expenditure. Now look at the amount. It was 5500. It goes up to 62, a 12% increase in the budget for the next year, but they actually ended up spending 8%, not the 12%. And the next year, that is 22-23, the allocation is about 14% higher. Then central sector schemes, all those national programs that I mentioned, they come in the central sector schemes, at least some of them. AIDS control, zoonotic disease control, surveillance, and a whole lot of those things. Now look at the allocation. What they spent in 2021 was 21,000, but the next year they allocated just 50% of that, a 50% reduction. And actual expenditure is actually 35% lower, all these national programs. COVID year, so they could get away with this. They didn't have to spend on a lot of these things. But look at the allocation for this year, that is 20-23. It is just 6% higher than what they have spent on 21-22. So central sector scheme, all these national programs, the slide that I showed you with about 15, 20 heads, you practically get no allocation for it. It has actually come down. Then other central sector expenditure, that is all these statutory and regulatory bodies like Medical Council of India, Food Safety Organization, and a whole lot of those things. Now there you see actually allocations have gone up over the years and by substantive sort of amount. Then autonomous bodies, that is AIMS, DIPMER, and the Chandigarh Institute, so a lot of them. Now you look at, it started with 7,500, a 13% increase in the next year's budget, but they actually ended up spending 16% higher. And next year, it's a 14% higher allocation. So you just compare these 3, 4, you will see whatever has to be given to the states, that has been cut. Whatever is for the central government establishments and institutions, it has gone up. That's the message that is coming here. And now the same Department of Health and Family Welfare transferred to the state, now National Health Mission and Prime Minister's Ayushman Bharat Yojana. Now you look at National Health Mission, that 37,000 in 2021, allocation for the next year is practically, there's no increase, actual spending is lower. And what is the allocation for next year, 20 to 23? It is same as what was spent in 2021. With all this COVID, this thing, that thing and all, your National Health Mission, that is basically this money you are transferred to the state, that has shown no increase. That means in real terms, it's actually come down. As you would see, even in 21-22, though the allocation was 36,000, almost comparable to what was spent in 2021, actual spending was only 34,000. It is actually about 7% lower. And the allocation for next year is no different from what it was 3 years ago. And PM Ayushman Bharat Yojana, this health insurance thing, of course, the allocation was much higher, but during that COVID year, 21-22, not much was spent, but still it was about 20% higher. Now, next year again, they have allocated 100% increase. So, if you look at the total centrally sponsored scheme, that is the two together, that is the National Health Mission and PM Ayushman Yojana, the two together, you will get something like that 39,000 becomes 42,000 allocation. But then actual expenditure in 21-22 was 50,000. So that seems a 10-12,000 jump. Why? That's because there was an emergency response which was needed with the COVID really ravaging the country in 21-22. That is last year, April, May and all that. The center has to pump in some money. Otherwise, you would not have had that increase. Now you look at what they have done for next year. That is this current year, 22-23 budget allocation is actually 5% lower. So they have absolutely no concern for health. They think that COVID is over. Now they don't have to bother about it. So basically, so if you summarize all those allocations, what you will get is that Ministry of Ayush has been getting a boost. Their allocation is going up, up and up. And in the Department of Health Research, allocation has not gone up because it is the same 3,000 crores, but the share of ICMR has continuously risen. It was 50% of the total for the DHR. Now it is over 70%, approaching 80%. So total doesn't go up, but ICMR is getting more and more. That means the rest of them are really suffering. And the Department of Health and Family Welfare, centers establishment, statutory organization, that is autonomous bodies, AIMS, DIPMER, they all get a lot more money, but not the others. Central sector scheme, the national program, they and the National Health Mission, they are starved of funds. They have been, these are headaches of the states, so states have to fend for themselves. That is the sort of attitude of the central government. Now, not only starved, but something else is happening under the both central sector schemes and National Health Mission. What is that? Now, central sector schemes You see, your total allocation is this 21,000. Under that comes this Pradhan Mantri Swasthya Suraksha Yojana. I'll have more to say on that in a minute, but you just look at what is happening. The Pradhan Mantri thing is getting a lot more money. 6,800 out of 21, 7,000 out of 10,000, 14 out of that, 7,400 out of 14. Then next year, the allocation is 15,000, but 10,000 goes for Pradhan Mantri Swasthya Suraksha Yojana. So you see, central sector scheme, all the national programs, they are not getting money. What comes under that as Pradhan Mantri Swasthya Suraksha Yojana, that is basically eating away whatever is being allocated. So net central sector scheme, you see about 15,000 was spent in 2021. The allocation next year is only 5,000, 5,163. Now this is the number that I am referring to. Just look at where we were in 2021 and what is the allocation for this financial year. That's 21-22. Only 1/3 what was spent 2 years ago. This is for the national programs. But this one, the Pradhan Mantri Swasthya Suraksha Yojana, just you see, 6,800 has become 10,000. Then National Health Mission. This is the allocation, no change. But establishment of medical colleges and increase in seats under that, now that is 5,000 has become 5,600. Now it has become 7,500, a 50% increase. So if you deduct this from this, what you get is, it was about 32,000 here. It became 29 in 21-22. Now you see it has remained more or less the same next year. So these other programs under the National Health Mission, they are starved of funds, but establishing medical colleges, that's going up. Now let us take up the Prime Minister's Swasthya Suraksha Yojana. Now what is it being done with this? Now I just quote from the budget. It has been launched with the objective of correcting regional imbalances in the availability of affordable, reliable tertiary healthcare services, and to also augment facilities for quality medical education in the country. The scheme envisages setting up of 6 AIIMS-like institutions, one each at Bhopal, Bhubaneswar, Jodhpur, Patna, Raipur, Rishikesh in the first phase, 9 AIIMS at Raebareli, Gorakhpur, Mangalgiri, Nagpur, Bhatinda, Bibinagar. You look at the spelling mistakes. I just quoted right from there, from the budget document. Kalyani, Devgar, Bilaspur, where OPD and MBBS classes are already functional. 3 AIIMS at Guwahati, Rajkot and Jammu, where only MBBS classes are running. Now you look at this quotation, this is from the budget, and you will find all these names. You note that only 2 south of the Vindhyas, only 2 names. This Mangalgiri in Andhra Pradesh and the Bibinagar in Hyderabad. Otherwise, you know where all these are. So this is something which is very, very striking. I'm really surprised that people have not taken it up for discussion. So we make a lot of noise about a lot of other things. And there doesn't seem to be, well, there is some method in this whole thing, but okay. And then what it really means is that now under the central scheme, if these AIIMS are being accommodated, then that's no different from autonomous bodies. Now, it also envisages upgradation of 13 existing government medical colleges and 6 in the second, and whole lot of those things. And then, of course, there is this statement saying that no, we are not neglecting any region. In addition, it's also proposed to set up AIIMS in each state in a phased manner, etc., etc. So the Kerala can take some solace from these statements. So central sector schemes, all these national programs, they are not being given money. Whereas quite under that, a lot of money is actually going into this PMSSY. So now over 70% funding goes for AIMS and medical colleges. So maybe we should include them along with autonomous bodies rather than calling them central schemes. So that is the message that comes through. Then under the National Health Mission also, what you find is that there are two items, that 57.01 and 57.02, because one of the lofty principles of National Health Mission is, human resources for health. So medical colleges is justified. So there is the allocation made for National Health Mission, but going for medical colleges. So the increase under this head for these medical colleges is 40%, when overall your budget allocation actually has dropped. So what has happened? So in Health Mission, Rural Health Mission was launched in 2005. So in 15 years, we are back to dumping primary care and fund more of tertiary care. So that is what the message is. Because we started NRHM to, upgrade the institutions in the rural areas so that we get quality, we deliver quality healthcare to the rural, to the unattended, to the poor, to the destitute. But now all that is just gone out of the window, and we are allocating under the National Health Mission, but the bulk of it is actually going for setting up medical colleges. That is the story that is coming to the budget. So that's what I just mentioned. It's what is. Then of course you have this Ayush. Wherever you go, you talk about Ayush, but then the allocation is still very small, but it's rapidly increased. Then of course ICMR, because that gets a lot more money because all this COVID and all that, you need people. So what is given to DHR is basically you are giving to ICMR. All the other sorts of things which come under DHR, they are basically forgotten. That is what it is. Then that is this very, very interesting thing. If you look at the whole, items, you will find that in the Department of Health and Family Welfare, now PM as prefix, out of the 64 items, in 6, you have the PM as the prefix. Prime Minister, Pradhan Mantri Swasthya Suraksha Yojana, Pradhan Mantri Garib Kalyan Yojana, Pradhan Mantri Ayushman Bharat, Pradhan Mantri Ayushman Bharat, this thing, that thing, infrastructure. You see, Pradhan Mantri this, Pradhan Mantri that. What is the total? You see, totally something like close to 1 lakh or 90,000 under these. Out of that, 45,000 crores is coming under this PM this and PM that. That is the story of this budget. Now, why? And, a bulk of them for AIMS and medical colleges, this PM allocation. Now, and then I pointed out that, only 2 south of the Vindhyas. Now, it looks quite capricious. Now, if it is a rule-based allocation, you would have expected something different. But what has really happened? What has happened is that earlier there were 2 institutions which sort of took care of this rule-based allocation, or which stood for the rule-based allocation. One is the Planning Commission and the other is the Finance Commission. Now the Planning Commission is gone. So one which allocated money on a rule-based allocation, that is simply disappeared. Now there is only Finance Commission. Now, if you don't have a rule-based allocation, an institution standing for that, and the government following that, then what happens is people can really have, use these allocations to serve their purposes. And even when the Finance Commission makes allocations, you can do things which, suit your purpose. So, I will come to now I will turn to the Finance Commission. What does the Finance Commission do? I'm sure in your courses, I think I'm not too sure whether you have covered this Finance Commission, but I will have to start with some basics and I'll quickly go over it. But if you have questions, you can ask me at the end. Now, what does the Finance Commission do? Now, as you know, we found out in 7th schedule of the Constitution, the distribution of powers of spending and taxation powers. Now, more taxation powers are with the center in the Indian context. More expenditure responsibilities are with the states. So how do you manage? That's why the Constitution makers had a solution, Finance Commission. It is constituted every 5 years. They made awards. They made an estimate of what will be the total collection of the central government, what will be their expenditure needs, and what needs to be transferred from their collection to the states. Now, you see, this is the sort of a picture that you normally get. That is a vertical fiscal gap. Resources, that is the collection, union collects 63% of the total, states collect only 37% because it depends on the taxation powers. So the taxation powers, lot more is vested with the union government, like the income tax, corporate tax, whole lot of these. It's the union government which collects money. Whereas the states, it's largely the indirect taxes. Now with the GST, even that, it's actually the center has come in a big way. So the states have much less taxation powers. That is what is reflected here. But expenditure responsibilities, in fact, the states have more expenditure responsibilities. So it's just the reverse. So if this has to be satisfied, then a lot of this money has to flow here. And that is what the Finance Commission is supposed to do. And the Finance Commission often does it in two ways. There are two broad categories. One is tax share. That is what's called the, your tax, the pot, taxes and duties. The central government that collects it, how much of that should go to the states? That's a vertical devolution. Then you have grants of various kinds, local government grants, revenue deficit grants, disaster relief grant, and a lot of other specific grants. So this is the two categories under which Finance Commission makes awards. Now, as regards the vertical devolution, okay, before that, I just want to, because this report of the 15th Finance Commission was submitted in November 2020. That's after the first wave of COVID, but before the second. And so what they say in their introduction, we seek not only to fulfill the traditional mandate of the Finance Commission to allocate revenues across levels of government, but also to put in place and reinforce the structures, habits, and building blocks to increase our adaptability as a nation, a union of states, and a partner in a more sustainable global trajectory for human development. So this is what they say their aim is. And what they do is the vertical devolution, the tax sharing, they say they are not going to disturb what was awarded by the 14th Finance Commission. 14th Finance Commission gave 42% to the states out of the total kitty. Now they say they will award 41 because Jammu and Kashmir was a state when 14th Finance Commission was making the award. Now it has become a union territory. Union territories don't come under this scheme. So that is why, and Jammu and Kashmir was getting 1% of the total. So that's why that is retained. So 41%. That is as far as the tax share is concerned. Now, the commission, now they took up, they were witnessing, while drafting the report, the outbreak of the COVID, and it brought out the multiple challenges faced by the sort of a nation, the disparities, the interregional disparities, the inadequate numbers of primary healthcare centers, the health workers, all these sort of problems. So they will make the bulk of the award to the health sector. I quote from there, for addressing the pandemic situation and building further resilience to shocks, that is 15th Finance Commission for the first time took a deep dive into the health sector. Overall, we envisage enhanced public outlays for the health sector and also propose the creation of an All India Health Service. This is what I am quoting from their report. And they also recognize, this universal health coverage where the local governments have an important role to play. So they say it's actually, both rural and urban local bodies, they have to be at the center of this provision of the services, the universal healthcare services. So they have to be brought in, and the local governments have to be provided the resources, and health infrastructure needs to be strengthened at all levels, at the local levels. This is what they, their assessment is. And they actually make grants to the local governments for taking up these challenges or these investments. That is, to set up diagnostic infrastructure, the primary healthcare facilities, sub-centers, PHCs, urban PHCs, block-level public health units, urban health and wellness centers, whole lot of those things. And this is what they have allocated each year. This 13,192, you must have seen in that first table where I said, the three items, FC grants, Ministry of Ayush, and Ministry of Health and Family Welfare. There you would have seen this 13,192. That comes from here, the Finance Commission's award. Now, also, what this Finance Commission did, you see, normally the Finance Commission doesn't get into a very detailed analysis of any sector because it's not strictly their sort of a remit. But given the context, given the COVID situation, the main report has one full chapter titled Pandemic and Beyond, Building Resilience in Health Sector. Now, this is a very unusual step. And in fact, I consider it as a must read for any student of health because the sort of analysis that they have done and their sort of the findings and the recommendations that follow from it, I think are very, very important. Now, there are a lot of things they find, that is the disparity, the poor infrastructure. They list one by one. And one of the reasons they say this, the very low level of the provision of health services is because the states allocate very little money. In fact, if you look at this one, this is actually from their report, where they say per capita health expenditure by states. Now, I'm not going to spend time because this in itself could be one full lecture, but I'll just quickly go over it. And I would say, because it is, normally said that about 8% of the total expenditure of any state should go to health, but no state really, that is what this side is. How this is the 8%, but what is the actual sort of a percentage? You would see it's much lower. It's about 4% for some cases. And some, like Tamil Nadu and Kerala, it is 5.5, 5.9, or close to 6. And then you look at the per capita health expenditure. See, Bihar, it's 616 rupees. Uttar Pradesh, 800. And Kerala, where is Kerala? Here, 2,000. That is over 3 times what Bihar spends. So no wonder Kerala, the facilities are much, at a much higher level compared to Bihar and Uttar Pradesh. Now, the Finance Commission recognized this, and that is why they, made these recommendations to upgrade the health infrastructure, and they again emphasize that health spending by state should be increased to more than 8% of their budget by 2022. Primary health care should be the #1 fundamental commitment of each and every state, and that primary health expenditure should be increased to 2/3 of the total health expenditure by 2022. Why did I make it bold? Now you contrast this with what the central government has done. How did they allocate money? For what purposes? So I don't want to say anything more. You just have to contrast, this with what they have done. So public health expenditure of union and states together should be increased in a progressive manner to 2.5% of gross domestic product by 2025. If this has to happen, then you see union allocation also has to go up steadily. But what did we find? We found that, in fact, in many cases, it was many sectors, it was lower than what we spent in 2021. Then how will we reach this 2.5? There is a document called National Health Policy accepted by this government, where they say 2.5% of gross domestic product should go to health. Now, if they themselves don't meet that, then how are we going to, there are, of course, many other recommendations that the Finance Commission makes. Now, the health grants, they put it under 3 heads. The grants aggregating to 70,000 over 5 years, it is made through local governments. It comes under the local government grant. Then sectoral grants aggregating 31,000, state-specific grants again for health aggregating 4,800 crores. So the total grant in aid support for the health sector over the evolved period of 5 years is over 1 lakh crores, which is 10.3% of the total grants in aid. Now, this shows that the Finance Commission attaches great significance, the importance to the health sector, especially in the context of COVID. Now, it's all right for the Finance Commission to make these awards, but the final arbitrator is the central government. They can either accept or reject the recommendations. Now, that is what is to be found in the action taken report, which needs to be submitted or laid before the Parliament along with the report of the Commission. And if you look at the ATR, it's available on the site. Those of you who are interested can have a look at it. What you find is that the ATR summary, sharing of union taxes, 41% is a recommendation, the central government accepts it. Revenue deficit grant, central government accepts it. Local government grant, accepted. Disaster related grant, accepted. All the other things, that the grants for states of specific sectors, including health, education, not accepted. State specific grants, not accepted. Modernization fund for defense and internal security, not accepted. But of course, the ATR doesn't put it like this, not accepted. They have a euphemism for that. So, these are the sort of wordings you will often see. Government will give due consideration to sectors identified by the Commission while formulating and implementing existing and new centrally sponsored and central sector schemes. So this is the way they often put it. They won't say we reject that recommendation. They will say, yes, government will give due consideration. What it really means is government is not going to give any consideration. You can, forget about it. That is what. So what does it convey? So Finance Commission's detailed analysis of health sector and the recommendations are not considered by the center. Instead of district and lower level health infrastructure, Union government decided to go up tertiary care, AIIMS and medical colleges. As I showed you, a lot of money has gone in for there, not for the other sorts of things recommended by the. Similarly, health sector grant, it was considered very important by the Commission. They devoted a lot of energy for it. But the Prime Minister and the Cabinet did not think so, despite the COVID times. Now, Commission had a premonition that the Union government will not accept this recommendation. That is, sector-specific grant or the state grant, but for the because this Commission, it's not. This is in a way the second report. They had given a report for year 2021 for just 1 year, and then the term was extended. So they had recommended something of this in that 1 year report. And some of it was not only not accepted by the Union government. In fact, this Union government had the audacity to say that, write back to the Commission, say that you reconsider some of your recommendations. It is never done with the Finance Commission. The union government doesn't write to the Finance Commission saying that you better reconsider some of these recommendations. But that they had done it, this government. So the commission had a premonition that something of that sort will also happen here. That is the reason why, that 70,000 out of that 1 lakh for health related things, they put under the local government grant. Now, local government grant, the central government cannot sort of, reject it because it's a, it's a local government sort of a thing. It's a constitutional sort of a, some sort of a binding. So the Finance Commission knew it. That's why the bulk of it they put under that. And so that at least, and of course they drew the Kerala experience, health sector and the local government and a whole lot of they also knew that the Kerala experience or doesn't, situation does not prevail anywhere else, but they put all that and very nicely written, but basically they played a one-upmanship on the union government, suffering the humiliation of earlier year. So at the end of it, of course, the health sector did get some money, but not because of the central government, because the Finance Commission was clever. But see, the message is, now there is a saying, you definitely must have heard this, don't waste a crisis. Pandemics are opportunities as well. It's a crisis, but it's opportunities as well. The government of India has wasted a crisis and lost lives in thousands during the second wave. This report was submitted in November 2020. If only they had not wasted this crisis, listen to the Finance Commission, things would have been at least marginally different. But I don't think they had that sense. So they have actually wasted a crisis. And in the process, taken the health sector back by a few decades. And not only that, the main message that comes through is that there is no money for primary care, hospitals, or laboratories, but there is money, lot of it, for Ayush, for AIMS, for medical colleges. Now, these are the aspirations of the middle class, very vocal. So we meet doubts. We make big story about it. We make these, these are not rule-based. These announcements are made in election rallies, basically catering to this class of people. So we are doing something very big. We are setting up aims. But what should have been the sort of a thing? Going by the NRHM experience or going by the recommendations of the Finance Commission, what should have been done is something very different. But ordinary people are not going to, are not going to know that or are not concerned about it. So this becomes big. Oh, Bhopal getting AIMS or Rajkot getting an AIMS, it's a big thing. AIMS, as if AIMS is going to change this, country for good. You look at what the AIMS contribution to the medical sort of a care or medical research in this country, you will be shocked. But people, for them it is, IITs, the AIMS, medical colleges. The moment we talk about it, it's big. So that is what is being played. So you basically meet the aspirations of the middle class. Let the states take care of the primary care needs of the poor, but we don't give money to the states. The states, let them find resources and do that. And they will take care of the rural folks. That is the message that's coming. Thank you very much. Thank you for the patient here.